Good afternoon, everyone. Hi, CA Herambagade. I'm sorry, unfortunately, at the last minute technical glitch, my video is not working. I'm a part of the Skill Development Committee. Welcome the speaker and all the attendees on behalf of Karnataka State Chartered Accountant Association to today's webinar. We have assembled today to know about the super hot topic of the hour, and it is still most confused, the COVID-19. In today's webinar, we have been focusing on the COVID-19 second wave, fact and myths. There's a saying, a good physician treats the diseaser, but the great physician treats the patient who has the disease. It is indeed my privilege to introduce today's speaker, who is innovated a new technique of performing a balloon mitral valvuloplasty in difficult cases, and this procedure is named after him, and it is called as Manjunath's technique. The doctor has done original research on the Acura balloon and resulting in balloon valvuloplasty operation becoming cheaper by 30 to 40%, and thereby providing an immense relief to poor patients in India and other developing and underdeveloped nations. Doctor has distinction of training American, UK, China, and all other countries' doctors on balloon valvuloplasty at Sri Jayadeva Institute of Cardiology in Bangalore. A great person attracts a great people and know how to hold them together. All Indian Institute of Medical Science, New Delhi, visited Sri Jayadeva Hospital in Bangalore to adopt the Jayadeva model, how to manage the hospital administration, basic amenities, and facilities to reach the common patients. A treatment first, payment next. A doctor has very exclusively implemented the concept that every needy patient should be given a quality treatment, irrespective of their financial affordability. Under his leadership, Sri Jayadeva Institute of Cardiovascular Science and Research, Bangalore, has been accorded with NABH accreditation. This is the only public heart institution in the country to get this distinction. With this brief introduction, it's a time for us to keep our mind and ears open and get the knowledge. I request the attendees to post their queries or the questions in the chat window, and same will be taken up by the speaker at the end of the session. Please join me to welcome Dr. C.N. Manjunath, the Padma Shri awardee. Over to you, sir.
Yeah, at the outset, I am very thankful to Karnataka State's Chartered Accountant Association for this invitation to talk on really the burning topic of this century, not just this year. It's really heartbreaking. I mean, the disease of this century on COVID-19, that too particularly in we are in the middle of the second wave. So first of all, this coronavirus is nothing new. It is basically a disease of animals, and as you know, the mother source of coronavirus has come from Wuhan city of China. Unfortunately, we don't know what is exactly happening in China because it's totally cut off from the rest of the world, and there is no communication because this COVID-19 pandemic is really haunting the entire globe, and it has not spared any countries on this earth. So we are in the middle of this COVID-19 pandemic second wave. And COVID-19, actually, there is some difference between the first wave and the second wave. The first wave, we never saw such a huge surge of cases. You take, for example, Karnataka itself. At that point of time, just there were about 12,000 deaths. Now, just what used to be in about 1 month, now the same number of cases and same number of deaths are happening in just 3 days. So that is the veracity and the speed with which this second wave is spreading. So in Bangalore, at this point of time, Bangalore is the epicenter as far as Karnataka is concerned. And see, the usual behavior of this virus, COVID-19 pandemic, is always it starts in bigger cities. Then after a gap of maybe 3 to 4 weeks, it starts moving towards the periphery or the non-Bangalore or district places. So virus doesn't move actually. Virus doesn't move. It is the people who are moving the virus. So the important thing behind this particular statement is, as long as you are not unnecessarily moving out in and out from one place to another place, this disease you can be controlled and contained. Unfortunately, in our country, our social structure is like that. People who are living in bigger cities, weekend they go to their villages or to the other smaller towns, or even for that matter for car festivals or village festivals and various Ratha Yatras. Of course, I don't want to talk about all those political meetings and the elections. So there's a popular saying, COVID and crowd go together. I think this summarizes everything. So one has to avoid this crowding and gathering and grouping. This is the bottom line of control of COVID-19. So let me just talk about some of the symptoms of COVID-19. Most of us are well versed at this point of time. Yes, fever, cough, headache, body ache. These are some of the routine symptoms. But some of them will have just mild headache. Why I'm emphasizing is, just because you get one day headache, one day fever, mild fever, one day body ache, or just one day common cold, you should, in the background of this COVID-19, you should never discard the symptoms as a common cold, and it is essential and imperative that you should get tested for COVID-19. However, the symptom may be mild. It's just a mild fever. A lot of people keep telling, I just had some nasal congestion and one day fever. Should I go for testing? Please go for testing, because the only way, the mantra of controlling this COVID-19 is, even WHO also has said, test, 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 and test. If you test and if you turn out to be positive, then you can always isolate from yourself, quarantine from yourself, and not only you are protecting yourself, protecting your family members, friends, and also ultimately community. So the testing is very important. Then coming back to some of the other symptoms that are coming up during the second wave is abdominal pain and diarrhea. Even if somebody has got mild fever and abdominal pain and diarrhea, that is also a symptom of COVID-19. Should not think that no, I had taken some food, that is the reason, and there may be some stomach upset, because these receptors through which the virus enters the body, they are mainly in the lungs and also to some extent in the heart as well as in the blood vessels and on the intestine. So that is the reason, primarily it's a lung disease. It can also affect the blood vessels, blood clotting can occur, and a mild heart attack or even a massive heart attack can take place. And when the intestine is affected, they can have abdominal pain and diarrhea. And loss of taste and smell is also a very important symptom. In fact, loss of taste and loss of smell is superior than your swab test and an RT-PCR test. So that is the reason, if somebody is not able to smell a coffee, not able to really appreciate the taste of a chocolate, then you have to suspect, yes, it is a COVID because of this pandemic background. And other rare symptoms can be redness in the eyes, that can happen, and also there can be some rashes also, some rashes on the skin or on the face, rarely. But keep these things in mind. And my important point is, don't neglect even a minor symptom of just a couple of days body ache and common cold. You have to get tested and isolate yourself. Another important thing is 85 to really 90% do not require any specific treatment. This is very important. 85 to 90% of patients infected with the COVID do not require any specific symptoms treatment. Only they require some pain relievers or painkillers like paracetamol or a crocin or a dolo. That is one. And of course, we give some mild medication. I don't want to emphasize too much. One ivermectin is given. And in other words, those who are having mild symptoms, there is no big treatment. There is no specific treatment. It's only isolation, and you have to drink more water, consume fruit juice, and keep your system well hydrated. And most important is, whenever you are under home isolation, yes, that means you are, and of course, risk stratification is important. Just because you have mild symptoms, you should not do away only with the testing. So you have to undergo some blood investigations. Under these blood investigation, some specific parameters are required, particularly what is called CRP, that is a blood test, CRP, and second is blood counts, third is D-dimer. So these things are normal, then you come under low risk category and you can be at home. And most important, at home, you have to use a private toilet, your own toilet. The others should not come, because sometimes toilets also can be a source of spread, because this virus is excreted in your fecal matter. So if you have used a toilet, after 10-15 minutes somebody uses, they can get infected. The main method of transmission is by droplet infection. When somebody coughs, somebody sneezes, or somebody talks loudly, that is the reason we have to maintain a physical distance of nearly 6 feet when you are talking. If somebody is coughing and sneezing, your distance should be little more than 6 feet. It should be 9 feet, something like that. So as far as the spread of this virus is concerned, it's mainly through droplet infection. And that's the reason we keep telling many people, still there is misconception, there is misinformation that we should not touch the dead body. And so it's very unfortunate that many places they are not allowing the dead body to be buried in their villages. So a dead man never spreads the virus, because neither he can cough, neither he can sneeze, and is not breathing, and he is already encased in a bag or a cloth bag. And only those who are actually touching the physically the body only have to be protected with the mask and all. Those who are seeing from a distance, nothing will happen. This is unfortunately a stigma that has gone into the minds of many, not only ignorant people, quite knowledgeable people also. In fact, it is very unfortunate our community is responding, because that is the reason we talk about, yes, mask is the key, extremely important thing. Mask, in fact, is your social vaccine. Mask is the one which is going to prevent and protect you from COVID infection. And there are many types of masks. One is your simple surgical mask. Second is your N95 mask. And of course, a lot of people use cloth masks. Suppose an infected person is there, he has to use a surgical mask, simple surgical mask. It doesn't cost much, maybe 1 rupee or 2 rupee. Sometimes, yes, during peak season, it can cost little 3 rupees or more. But an infected person should protect himself with this 3-layer mask, or if we have an N95 mask, it is excellent. And others who are using the cloth mask, preferably, very important is they should daily, they should wash, clean that mask. Washing should be done, and next morning before wearing that cloth mask, ironing is a must. So otherwise, if you are not washing it properly, if you are not ironing the mask, yes, if you are repeatedly using it without this, then if you are an infected person, definitely you are going to spread this infection to people around. So this is very, very important. Mask is a social vaccine. Of course, we have Covishield and Covaxin. They are COVID-19 vaccine, but social vaccine is your mask. So there's a very popular saying, if you want to avoid ICU, you always wear a mask, and if you want to avoid ventilator, you always have a physical distancing. So coming back to those who are on home monitoring, yes, apart from isolation, eating fruits, vegetables, and also the cereals, and keeping, I mean, pulses are best because they have a lot of protein. And most important, physically, yes, you should be away, but mentally should be well connected. That's the reason people talk about social distancing. No, socially should be well connected, but physically there has to be a distance. So we have to keep talking. You have to keep talking to your fellows, I mean, your family member or a friend, and never discuss about COVID with them. At least 2 to 3 times you should call on, I mean, either a video call or a regular call, and keep talking to the people who are under home isolation. That infuses lot of confidence. And those who are on home isolation or in the hospital in a single room, try to avoid seeing this TV news channel. Best you can always see a sports channel or a comedy channel or maybe entertainment channels. Otherwise, because if those things will have a lot of psychological effect, because COVID-19 is there is one disease. It is one disease. In one disease there are two diseases. In this COVID-19, although it's a one disease, in this one disease there are two diseases. That is, one is virus, second is psychological factor. So there is a lot of psychological factors involved in that, because unlike other diseases, you can't talk to them, you can't go near to them, you can't have a dinner or lunch with them, you can't sleep in their room. So that's the reason I keep telling, in this one disease there are two diseases. And always yes, those who are home monitoring, because they have mild symptoms and they come under low risk category, maybe 10% of them between day 7 and day 10 can deteriorate and become very sick. So that is the reason we need to regularly monitor, even under home isolation, with your pulse oximeter. The oxygen content or the saturation need to be properly monitored, and normally saturation is somewhere between 95 to 99. If the saturation is below 94 or 93, yes, that is a red flag. That is the early warning for the patient and the family members. And if saturation is consistently below 94, 93, and that is the time you should seek hospitalization for better treatment. And also I emphasize another important thing. This RT-PCR test, although it is considered as a gold standard, about 10% who have definite COVID symptoms, definite COVID infection, and definite evidence of infection on the CT scan, they may not have positive RT-PCR test. So it is also to be treated as a COVID infection or COVID-19 disease. What is called RT-PCR negative, but just CT positive. This is another thing. And during this second wave, we see more of them. Of course, not a very high percentage, but compared to the first wave, it is more, about 10 to 12% of COVID-19 infection people, the RT-PCR test is negative, but they have COVID symptoms, and you take a CT scan that shows typical COVID features. So that also we have to consider and treat as COVID infection with, and whatever treatment that is there. I mean, same thing has to be given for this. Another thing I wanted to emphasize is there is lot of hue and cry about one drug called remdesivir. 85 to 88% do not require this drug remdesivir. Remdesivir is just an antiviral drug, broad spectrum. It reduces the viral load. So then who are the people who require remdesivir? Only those patients who have a low saturation, that is saturation less than 94, 93, or your chest CT scan showing a large portion of the lung is involved, and those who have got continuous high fever with some chest X-ray abnormalities, or those who have a breathing difficulty, only requires remdesivir. Otherwise, unnecessarily this remdesivir should not be used. It should be judiciously used. In our opinion, 85% of COVID patients do not require this remdesivir. Yes, coming back to vaccine. So at this point of time, we have in India two types of vaccines. One is Covishield and other is Covaxin. Both are safe, both are effective. Both are safe, both are effective. And yes, now as per the vaccine policy, 45 years and above are the eligible beneficiaries. And in some days to come, probably between 18 to 44 also will be vaccinated. See, most important is the objective of vaccination is basically for protection, not for prevention. Even after vaccination, they can get infected. So even after vaccination, people should always continue to wear the mask, because one should not be under the impression, oh, I have taken vaccine, both the doses I have taken, yes, can I move freely, or can I talk to, can I have a party with many people without wearing a mask. Even after vaccination, you should continue to wear the mask. Otherwise, so some people might ask, if I am going to get infection after vaccination, why I should take vaccine? The objective of taking vaccine is if in the by chance if you get infected, the severity of the disease is reduced and the death rate is significantly reduced. Just to keep it simple, I can give an example. Taking vaccine against COVID-19 is like traveling in a car with seat belt and airbag on. So in case if there is an accident, you will get protected. And yes, there are some unanswered questions. There may be some people worried about taking vaccine. Vaccine causes mild fever. Some people after vaccination can have mild fever. They can have body ache. And so see, these are not adverse effect. See, there is a difference between effect and adverse effect. So we have seen our children getting vaccinated for polio, maybe even BCG, or even for hepatitis vaccine, so many vaccines. So after vaccination, it's natural, but it's natural to have a fever and headache, body ache for 1 or 2 days. So after vaccination, if somebody gets mild fever or body ache, it is not an adverse effect, but it is basically an effect. That means you have taken vaccine. And some people say, no, I'm getting pain at the injection site. What does it mean? See, any injection you take at the injection site, there will be a pain. So these, of course, regarding this interval, of course, the interval policy has been revisited and been revised. And now the government policy is anywhere between 12 to 16 weeks after the first dose, you can take the second dose. And 80% after vaccination will get antibody. So antibody response that is going to protect you against any severity of the infection. And yes, this is about vaccine. And again, I repeat, even after this, hopefully by June first week, this number of cases will start dropping. Even afterwards, maybe till December, we should try to avoid gathering. We should be very choosy, and because your wearing mask should be part of your culture for next 6 months to 9 months, because many times what happened, this is what exactly happened. Last November, number of cases came down, and people believed that COVID has gone once for all, and they were not following any precautionary measures. And then it came back in a big way. Now we are experiencing the brutal attack of this COVID-19, and it's exactly like a COVID-19 tsunami what we are facing. So wearing a mask for next 6 months should be part of our daily culture, daily routine. And because immunity is also important. Don't bother about income. Immunity is important. And yes, a word of encouragement a word of, few sympathetic words will also be a vaccine to people who are suffering. So I think you should physically, yes, you should maintain a distance, but socially you should be well connected, and one should not get into depression. That's very, very important, because 97 to 98% are going to recover. What we are seeing on television, various very difficult, distressful scenes, I agree, but better try not to look into these TV channels repeatedly, and don't try to scan your Google and social media. There are a lot of fake things coming up. So I think most important, have self-confidence. Self-confidence is also a medicine, and this is how we are into second wave, and hopefully a number should start dropping by June first week. And Bangalore, it will start coming down in another 1 or 2 weeks, but the districts are going to peak. So this is in summary about COVID-19 pandemic. And anyway, I will be very happy to take some questions.
Sir, yeah, we have received some of the questions, sir. The first question is on vaccine. How does the vaccine work in controlling the effect of virus? And what will be the expected efficacy of the existing vaccines on the new mutants of the virus?
Yeah, I think the vaccine is going to give protection around 80 to 82%. And also, it should also act against the mutant virus, because the virus what we have is B1617, Maharashtra strain, we call it as. It's quite rampant in South India, while UK strain is rampant in Punjab. So vaccine, see, again, I have made it very clear, vaccine is basically for protection, not for prevention. And definitely vaccine has to be taken to really reduce the spread and reduce the number of deaths. See, whole objective of COVID treatment today is to reduce the deaths, number of deaths, as much as possible.
Okay.
In Jayadeva Institute of Cardiovascular Sciences, we did just a study. 140 healthcare workers have received vaccine. We did an antibody test. 80% had a significant number of percentage of significant level of antibodies.
So the second
And
question.
another thing is, some people will ask, I just suffered from COVID-19. When can I take vaccine? That is another question many people keep asking. Suppose if you have recovered from COVID, then possibly better to wait for at least 4 to 6 weeks after recovery from your COVID.
Yeah. So the second question is, if a patient is on blood thinner, can he take vaccine?
Yeah, it's a very practical thing. In fact, COVID-19 infection, apart from targeting the lung, it targets the artery. It causes blood clotting in the arteries. Rarely it can cause heart attack and stroke. So if somebody is taking blood thinners, it's very nice. It's very good. They should take vaccine. And blood thinners, and there is no need to stop blood thinners before taking vaccine. They should continue even if they have suffered an heart attack, or if they have undergone bypass surgery, angioplasty, if they are undergone open heart surgery. They should they should never stop this medicine. They should keep taking this medicine. And blood thinners and vaccine, there is no interaction at all. They should not stop blood thinners, and it is safe to take vaccine.
And then one common question is, which vaccine is good? No, that's also a question.
Yeah, both are good. Both are good. Both Covishield and Covaxin, both are good. Both are safe. Both are effective and efficient.
Okay. Is pneumonia or chest congestion common during recovery?
Yeah, in fact, one of the major presentation of COVID-19 is pneumonia only. That we call it as COVID pneumonia. See, even after recovery, after complete recovery from COVID, some people, after a gap of 2 to 3 weeks, they develop some tiredness, fatigue, sustu anta heltaralla, fatigue, tiredness. Those people should get re-evaluated, they should get an ECG and the echocardiogram for the heart function and all. And 6 minutes walk test is very important. After even those who are on home isolation also, if the saturation is dropping to 94, because normally it is 95 to 99, if saturation is dropping to 94, 93, you just check your saturation when you are at rest, then you walk for 6 minutes, then soon after walking 6 minutes, you check your saturation. If saturation is not dropping further, then it is an indicator that the lung involvement is very less and the disease severity is less. 6 minutes walk test is also a very useful, simple test to know the severity of the disease. And after recovery from COVID, particularly those who are admitted in ICU and those who had low saturation during the active phase, normally we give blood thinners for at least 4 to 8 weeks to prevent a clotting of the blood in the arteries.
Sir, there is again question on yoga and pranayama. Has shown any positive results in COVID? Is it true?
That is for a general well-being, general health. Yoga and pranayama is always good because it improves your physical fitness, it improves your respiratory efforts, and that's always a good thing, pranayama and all those things. See, another thing, suppose if saturation comes to around 87, 88, and patient has got little bit of breathing difficulty, you are not getting the bed, and you are searching for bed, and probably you are not getting the bed immediately, those people can lie down on the face. They can lie down on the stomach, and that is called proning position, and that itself increases the oxygen saturation by 3 to 4%.
So can the blood thinner medicine be taken without doctor prescription after vaccination? Because there is a news that COVID shield has potential to clot blood in younger people.
Actually, this study observation came from Denmark and Norway. Out of 2.5 crore population, 63 had blood clot. Out of 2.5 lakh population are beneficiaries. So it's a very small, insignificant effect, but without prescription, you should not take. Because there are many types of blood thinners, like aspirin, clopidogrel, or anticoagulants are different. Antiplatelet, I think there is a difference. I don't want to get into too much of technicality. And there are a mild variety of blood thinners, and also there are, higher variety of blood thinners, and they should not mix. And another thing, the first dose vaccine, if you have taken Covishield, second dose also should be Covishield. They should not mix it up.
Sir, there is one question on oxygen concentrators. Now, these are also rampantly used and panic buying has happened. So when is it used and what is the cases when it can be?
Normally, oxygen we should start using when saturation is below 90%. Okay. If saturation is between 90 to 94, I think no need to use oxygen. These oxygen concentrators are used when only people who have mild or moderate symptoms, and the oxygen delivery is between maximum up to 10 liters can be given per minute. So those who require a minimum quantity or a moderate quantity of oxygen concentrators are useful. When somebody requires a very high quantity of oxygen generators will not be useful.
Okay. So the next question is, when this pandemic will end, what are the precautions other than mask and social distancing, and regarding especially on the third wave?
Yeah, I think going by this natural history of this particular COVID-19, what happens when one wave comes, it gives a gap of about 60 to 90 days, then the another wave sets in. So going by that trend, probably November, December could be the period of third wave. So again, even when once the second wave settles down, the restriction on gathering should continue. Restriction on marriage, restriction on festival, social, religious, political function should continue till December.
Oh. Sir, I heard that the Indian mutant is not even detectable by the test after some days, as it is absent in throat and reaches lungs, and situation is only understood by CT scan. Is this true?
Even earlier, even with the during the COVID first wave also, you used to see this where RT-PCR test used to be negative and just CT was showing positive findings. But in this second wave, this mutant, double mutant virus, it is much more. So, because sometimes see, that is the behavior of any life, any living organism. If you are trying to treat, if you are trying to eradicate, it escapes. This is exactly like when you are traveling, if there is a traffic junction, then you try to take side roads and go, no? So that is called mutation. So it also tries to escape your vaccine. It also tries to escape your treatment.
So there is one issue which is recently coming, which is on black fungus. So can you just throw a light on what is black fungus?
This is basically a fungal infection. This is common in people where in those group of people where immunity is less. We call it as immune compromised. So immunity is less in people who are having long-standing diabetes, those who are having cancer, those who are having cancer, those who are on chemotherapy and HIV infection, and some of these arthritis diseases. So whenever immunity is less, so this fungal infection, we call it as an opportunistic infection, it can happen. And abuse and overuse of steroids, that is the reason why this particular thing has cropped up now, because moderate to severe cases of COVID, these steroid drugs are used. That is the reason for mild symptoms, mild COVID illness, steroid should not be used. Many people out of anxiety, even some doctors are prescribing steroid for mild cases of COVID, that should not be given. So overuse of steroid and if personal hygiene is not good and with immune compromised status, then you can get this fungus infection. Of course, medical term is called mucormycosis, where it is called black fungus because it is seen as a black thing under microscope.
And what is the food specification after recovery? There is a saying that 28 days after recovery, diet is required.
I think no, right from day one, you should have a balanced diet. It should have more like a general good diet, balanced diet. Should have fruits, vegetables, and you should have more of pulses and egg you can take. If you are a non-vegetarian, chicken and fish you can have. So it's and you should hydrate yourself. You should have because sometimes with fever and taking medicine causes sweating and all. So that's all. There is no specific. All those things are, I mean, usual WhatsApp University products only. Your lemon juice or putting some lemon drops into nose, and also some people said even these cows urine and all. So in my opinion, lemon, if you are so much interested, you should not put it into the nose. You can make sharbat and drink.
Sir, there is one thing which is on the vaccine. Because of the vaccine shortage, the people are not able to get their second vaccine. So what is the maximum period they can wait? Because there are few people are already falling more than 5 weeks.
Anyway, now this is policy is revised anywhere between 3 to 4 months after the first dose. So I think although that is a revised policy, it can be taken anyway, maybe between best is between 2 to 3 months. 8 weeks.
Yeah. And they say if there is a dead body which cannot spread COVID, then why is it why is it covered in a PPE kit?
No. Sometimes what happen, there can be secretion coming out from the nose, from the throat. That we have seen, no? In a when you know come across dead bodies, some secretion, because if the patient is on ventilator, those tubes have been removed, and those secretions will be dribbling out of nose, dribbling from the nose. So those secretions carry virus. If it is already whole thing is put inside a bag, body bag, then it doesn't spread. And those who are actually physically touching the body, then they have to wash their hands properly with sanitizers. And that is the reason there is a very popular saying, don't touch men. So this is, you are asking me what should be followed, no? So don't touch men. Men means mouth, eyes, nose. Mouth, eyes, nose is men. And follow women, always follow women. So first W means basically washing hands. O means obeying the physical distancing. Another M means mask up. Then another E means your exercise and eat well. N is no to crowding. So there is some popular phrases coming. So most important is income is important, but if you fall behind income without proper precautionary measures, then so I think this time has come. Probably you have to show less interest to income, but more interest to immunity. Income and immunity.
So the one question is on vaccine. Is it one time or is it regularly to be taken? Because there is something called
That has to be studied again, because the entire this COVID-19 infection, illness, virus is everything new, and every 3 months some studies are coming up, some data is coming up, it keeps changing. Even the treatment strategy also keeps changing. It's a dynamic situation.
Yeah. And what kind of physical exercise to be carried out, especially when the lockdown is there?
Yeah, of course, you can always go for a walk, and while walking, you should not get crowded, and wear a mask and walk, no issue. So there is some misconception that when you are wearing a mask, oxygen level falls and all. Only you cannot run. That's all. So you get used to it actually. And otherwise, pranayama you can do, yoga you can do with your own compound. You can walk, and inside our house. Normally, I walk about 9,000 steps a day. About 6,000 steps I walk at home only, inside the house only. From other end of the house, from the front door to the back door, if you walk for 40 minutes, it covers about 6,000 steps. Ultimately, you should get into that mode, that exercise mode.
Sir, can even the diabetes patients also take vaccination? As a question by
Yeah, all the more, because those are the people who really require, because they are more prone for these infections.
And the one question is on plasma. Why is COVID recovered plasma donors are requested for a plasma donation?
Because they have antibodies. So the plasma means the watery portion of the blood is separated out and given. That has got antibodies. So when antibodies are given, it neutralizes the viral infection. But again, this antibodies should be given, plasma should be given in moderate to severe. If you give it during end stage, it doesn't work.
Okay. So the question is from Ranganath. He asked, 1 minute, I just. After the first shot, a patient had an attack of COVID, admitted for 11 days, discharged, and now after home quarantine tested negative. Is it safe to take the second shot now?
No, I think from the date of recovery, you have to wait for at least 4 to 6 weeks.
Okay. There is how to deal with this gastric after medication and recovery.
No, again, basically you have to have less spicy food and more. You can have more of banana, this thing, and spicy food you should avoid. It's like a general gastritis and all. So stress actually. See, as I said, in this one disease there are many diseases. Apart from viral disease, you have psychological factors. Then you have stress factors. So many things. When you are alone, you will be thinking so many things. When you are alone in a room or at home, you will be thinking so many things. Lot of stress management is very, very important. This is where the role of friends, role of family members, we need to motivate them. We need to really infuse confidence in them. And as far as these, confidence building measures, you should never look into all those false, fake videos or fake news on Google or Google search.
So one new medicine which is by the DRDO which is coming up. Do you have anything on that to say, sir?
Well, anyway, it is just we have to wait and watch. Okay, that 2-deoxy, 2D.
Yeah, 2D. The second, the one more question was on second wave is airborne. So still sanitations are not taken place. Whether sanitation will reduce the spread of COVID?
No, actually, this corona, even during the second wave, is primarily through a droplet infection, close contact. This one rarely airborne means in a less ventilated place. If it is a congested place, small room or small meeting hall where more people are there. So if somebody is coughing, sneezing, so that can happen in a close, less ventilated place or where there is no proper ventilation. So suppose if it's a very big hall, if ventilation is good, then chances are very less. So that is a very small percentage. It is basically confined to if you are holding a meeting in a small room or convention hall is very small, or even in a house if there are too many people close to each other, then there can be little aerosol spread. Otherwise, open air, no.
So there's a lot of confusion about vaccination. Few people are asking that within few days after taking vaccine, they have been detected COVID and they have died. So
Yeah, actually, it is just a coincidence because vaccinally, Covishield, there is no virus. Only that spike protein is taken out. So, ಅಥವಾ ಇನ್ನೊಂದೇನಾಗಿದೆ, the way people are crowding at the vaccination site, vaccination site is becoming a super spreader. So there itself they can get infected, number one. Or before taking vaccine, if they are already having a virus but without symptoms, then it can manifest little later after vaccination and it's attributed to vaccine.
So one interesting question was, will the lungs damage even without giving any symptoms? So is symptoms always there or can it deteriorate very badly?
Oh, yes, that can happen. I mean, people can have a very mild symptoms, then all of a sudden they can deteriorate. That's the reason one should carefully watch your saturation, because your saturation is the best guide. You may not be having much symptoms. Even if saturation is dropped to 85, some people do not have symptoms. What is called happy hypoxia syndrome. Hypoxia means low oxygen. So those who are having COVID infection should continuously monitor your saturation with pulse oximeter. And pulse oximeter, your finger should be properly kept. And if it's a wet finger, you should dry it. And regarding a cloth mask, I think best you should wash every day, you should iron it. Okay. And infected person should wear a surgical mask.
Sir, there is one news on the cytokine storm, which was we were reading. So is there any way it can be detected early, and how is it?
See, cytokine storm means there is a huge release of some inflammatory markers in the lung. They will have severe, again, they will have low oxygen saturation, breathing difficulty, clinical symptoms. Clinically, we recognize this by very low saturation and breathing difficulty. They will be breathing very fast, not able to lie down. Two, then by blood test. One is, of course, if you want, I can tell IL-6. If IL-6 values are very high, and if CRP levels are high, that suggests.
Okay, sir. So if next question, yeah. So last question, sir, if you isolate in a room and open the door, should we wear a mask even if there is no cough and cold?
Yeah, definitely.
Yeah.
Even while you'll be breathing, no? You may not be coughing, you may not be sneezing, but you are breathing. So breathing brings out the virus.
Sir, in flu, generally there is something called as booster shots. Is it something which we are seeing in vaccine also, which will come?
Anyway, we have to wait and watch because, see, now following vaccination, antibodies will appear. And how long they will appear and how long they will last also we have to study. Suppose after 9 months, if the antibody levels drop, then there is a need for booster dose. So everything, lot of new things are going to come. There is nothing like a fixed things at this point of time.
Okay, fine, sir. Hiramba, if you can. Sorry, we might not be able to ask all the questions. I think, sir, we are already reaching 4:30.
Yeah.
We will proceed with the photo. Yeah. Siddharth?
Yeah. Yes, sir. Thank you, Pramod, for asking the questions. And sir, thank you for participating in this session and enriching us with more about the COVID and giving us more information about the COVID and the virus and the vaccination. And I know your time is very precious, especially at this point of time when a lot of patients are coming to you with various issues. It may be with reference to the COVID, or and as you are a cardiologist, a specialist, a surgeon, I'm sure that you have a lot of patients waiting for you. Thank you from Karnataka State Chartered Accountant Association for coming and accepting our request to come and talk to us. And I will also like to thank all the attendees for attending this session, today's session, and which was held from the Skill and Development Committee of KSCAA. And thank you all. And I hope Sir has been able to do the justice of providing us more insights on the COVID and the virus, which is the need of the hour. And request everyone, as Sir told, we have to be wary of our disease in our body, and we have to start talking to the doctor from the day one. And please do be careful with the disease, and don't spread the virus, spread happiness, and spread the awareness. Thank you. Thank you all.